2022 to 23 was a year of pressure and recovery, of hope and care, of partnerships and learning. Our outstanding staff were tired, yet continued to work together, supported by our dedicated volunteers and wider health and care system partners to do their best for our patients. The new integrated health system structures, introduced from the 1st of July 2022, have enabled us to further explore and define our role as a valued health partner in the county. The need for a more holistic approach to support our staff has never been greater. There is no doubt COVID-19, coupled with the unprecedented operational pressures, recruitment challenges, housing affordability, and the cost of living crisis have been tough. We introduced initiatives such as stress-relieving cold water swimming courses and personal health checks. We recognised the enormous efforts of our people with the summer party and award ceremony, and placed a huge priority on supporting the mental well-being of our people. Feeling a sense of team and teamwork is so important for well-being. It's that sense of team which has enabled us to do some things differently, to innovate, even during the most difficult of times. And that sense of team extends to our loyal and valued team of 400 volunteers who work with us to provide additional support to patients across our hospitals. From the reception desks, coffee shops, library trolleys, and companionship, our volunteers are there providing a kind word, a listening ear, a hot cup of tea, or directions to an appointment. The past year has seen us welcome around 200 international nurses and other healthcare professionals to our team, where we now have colleagues from more than 80 different countries making up our workforce. This brings a huge wealth of cultural diversity, which is reflected in the priority we're giving to equality and inclusion, educating our people, and the reinvigoration of our staff networks. The demand for care in our hospitals and right through the health and care system across almost the whole year were indeed tough, and were most visible from the ambulance queues at the emergency department at the Royal Cornwall Hospital. Challenges with delayed discharges and increased elective care waiting lists highlighted the difficulty we had in making space in our hospitals to care for those who needed it the most. To minimise delays, we made better use of a wide range of community-based care and support, including virtual wards, acute care at home, and the extensive range of services provided by the voluntary sector. Through the actions we took in readiness for winter, we also opened over 80 escalation beds and spaces, including a frailty same-day emergency care unit and an expansion of our discharge lounge. Our teams at St Michael's Hospital were extraordinarily flexible in supporting the care of medically fit patients awaiting discharge, utilising beds that would otherwise be used for those waiting for planned orthopaedic care. And our medical wards at West Cornwall Hospital and other surgical wards at Royal Cornwall Hospital frequently made space to care for patients from medical specialties. This was hard for teams in the knowledge that they had patients in need of treatment, but who they were unable to admit. Throughout, our priority focused on people with cancer and other life-limiting illness, but we were always mindful of the impact on the physical and mental well-being of those who are waiting for routine procedures. There were green shoots of recovery at the end of 22 to 23, and essential to our ambition to further reduce waiting times this year will be the ability to protect our key elective care facilities at St Michael's and West Cornwall hospitals. The opening of a new community diagnostic hub at Bodmin Hospital has increased the imaging capacity and is speeding up diagnosis for patients with cancer and other conditions. Since the opening in October 2022, it has been enthusiastically welcomed by people in Mid and North Cornwall who now have more convenient access to these diagnostic services. And we have continued to see a shift in the move towards virtual outpatient appointments, with telephone and video consultations now making up around 1/3 of our outpatient activity. Age has not proven to be a barrier to technology, with patients of all ages engaging in our patient hub, which provides access to online appointment booking, text reminders, and access to letters and test results. We made strides in the last year to further improve the way we hear from our patients, from valued partnerships with patient groups such as Kerno Maternity Voices, who are helping us to understand experiences of our maternity services, to our new Patient Leader program. Listening to and learning from the people who use our services is one of the best ways we can keep improving. We've been working to better understand our role as an anchor institution in Cornwall and the Isles of Scilly, and how we can help reduce health inequalities. As a partner in Cornwall and Isles of Scilly Integrated Care System, we have welcomed the new developments in system governance frameworks. We contributed to the development of the system's first ever Joint Forward Plan and Joint Capital Plan, ensuring alignment across our partners on the key things we will work on together to help the people of Cornwall and the Isles of Scilly start, live, and age well. Our partnerships are broader than just our health and care partners. During 2022 to 23, we signed a Memoranda of Understanding with the University of Falmouth and University of Plymouth. Alongside our existing MOU with the University of Exeter, these helped put us at the forefront of advances in areas such as medical device design, digital health transformation, and environmental sustainability, and strengthen our research and development expertise. Clinical research has a key role to play in enabling our patients to take advantage of the latest treatments and technologies, as well as building our reputation as a research hub and thus an attractive employer. RCHT is a pioneer of sustainability within the NHS, contributing to the overall NHS Net Zero target. We have continued our involvement with innovative projects, with the trial of a modular laundry system to support reusable theatre textiles, and collaboration with Falmouth University to explore how single-use plastic products within the hospital could be replaced with products from a recycled theatre tray wrap. Our new buildings and refurbishments included sustainable features and digital innovation from the outset. We opened the Tremennel unit in November 2022, and our new purpose-built MRI and oncology unit opened in spring 2023. We've also been busy improving our outside space, with 2 specialist garden projects developed during this period. We created a new children's play garden and started construction on a critical care healing garden. While operational challenges remain, we're starting to see improvements in our ambulance holds and the number of delayed discharges. We look forward to more innovation and transformation of our estate and digital infrastructure, providing us with state-of-the-art buildings and tools to better connect the care we provide and enable cutting-edge treatments. And no one project embodies this sense of hope as much as the Women and Children's Hospital programme. It's not just new physical builds we're excited about. We're planning for a new electronic patient record system to be delivered over the next 2 years, helping clinicians and support teams have a much greater range of patient information at their fingertips, and empowering patients with more advanced patient portal capability. As we acknowledge and reflect on 2022 to 23, we move forward into 23 to 24 with respect, compassion, honesty, and teamwork. Together, we aim to improve Category 2 ambulance response times to an average of 30 minutes, with further improvements towards pre-pandemic levels in 24 to 25. Eliminate waits of over 65 weeks for elective care by March 2024, except where patients choose to wait longer or in specific specialties. Continue to reduce the number of patients waiting over 62 days for cancer treatment. Make significant improvement in the percentage of staff who would recommend RCHT as a place to work. Deliver a balanced net system financial position for 23 to 24. But the way in which we seek to deliver those 5 priorities, using our new trust values as our guide, is more important than any outcome. We are RCHT.